Hello everyone and welcome to my channel. My name is Maria, and in this video we are going to be talking about the pros and cons of signing on to a nursing rotation program as a newly qualified nurse. How I want to structure this video, I want to very briefly talk about my experience with the nursing rotation, and then I'm going to go through the pros of the nursing rotation program and the cons of the nursing rotation program. So what is the nursing rotation program? The nursing rotation program is a program that a lot of hospitals are offering now. So when you graduate, rather than you saying you're going to get a job on X ward or Y ward or Z ward and be there for an X amount of time, what a lot of hospitals are offering, they're offering you the option to basically sign on this nursing rotation program where you'll spend 6 months on one ward. Once those 6 months are over, you'll spend another 6 months on another ward, and then you'll spend another 6 months on another ward, all within the same hospital or all within the same trust. Most of the rotations that I've seen available tend to be for a period of 18 months. You'll have 3 rotations that are 6 months long. Different rotations or rotations at different hospitals are centered around different areas of nursing. So you could have a cardiac rotation program, you could have a respiratory rotation program, you could have a pediatric rotation program. They're all centered around different topics, and you don't just find rotation programs in hospitals. I know some community services are also providing rotation programs for their newly qualified nurses. When I first got my NMC pin, and when I was, a brand new, fresh, newly qualified nurse, I signed on to a nursing rotation program. This rotation program, the plan was me to spend 6 months on a respiratory ward, 6 months on HDU, and then to spend 6 months on an intensive care unit. However, because of, I only did 6 months, the first 6 months at the on the respiratory ward, and then I completely quit that job, and then I signed on to a different rotation, or the same rotation basically, at a different hospital. And right now my first rotation at this second hospital has been on a cardiology ward, and I should have rotated over into a new area onto a private ward. However, what's happened with the COVID-19 situation, all of that has been scrapped, and right now I've been on my current rotation for a year basically. Rotations tend to start at September time. September time is one rotation, and then in April is the next rotation. So with this job that I'm at right now, I started in August, and then the rotation program didn't start until September, so I had like an extra month, and I should have rotated over into the my second rotation on the 1st of April, but like I said, because of COVID-19, none of that happened. All of that got scrapped, and I'm still at my first rotation. So we're going to talk about the pros of the nursing rotation. None of this is going to be in any particular order. One pro of signing on to a nursing rotation program is that it's very good for newer nurses who aren't sure of what part of nursing it is that they want to specialize in. So let's just say, as a student nurse, you had a very good neurology placement, you had a very good cardiac placement, and you also had a very good oncology placement, and you're not entirely sure what part it is you want to work in. Rather than saying, oh, I'm going to go for this job and I'm going to be at this job indefinitely, and if I want to leave this role, then I basically have to quit this job. Rather than saying that, you can just sign on to a rotation and say, actually, I'll just do 6 months on a cardiac ward, 6 months on a neurology ward, and then 6 months on an oncology ward. So it's a really good option, because the whole point, or one point that a lot of people think of the rotation program, is that once they've rotated onto 3 or 4 different areas, at the end they can choose where it is that they want to work at permanently. But I will expand on that point when I talk about the cons of the of any nursing rotation program. So yeah, one pro is that it's really good if you're unsure of where it is that you want to work permanently. Another pro of the nursing rotation program is that it gives you a wide variety of skills in a bunch of different areas. So let's yeah, it gives you a wide variety of skills in a bunch of different areas. The nursing skills that you'll use on a cardiac ward will be different from some of the nursing skills that you use on a neurology ward, will be different from some of the skills that you'll learn, that you'll develop, that you'll achieve while you're on an oncology ward. So it's really good for your learning because you learn so many different types of skills. And when it does come to the end of rotation and you're thinking, okay, where do I want to work? You have so many options available to you because you've worked in 3 different areas, and you can apply all the skills that you've learned in all those different areas and take it into your new position. Another well-cited benefit of the rotation program is that you basically are always learning all the time, because you spend 6 months on this area. There's not enough time for you to be like, okay, I know what I'm doing, I'm used to everything, let me just kind of like sit back and just kind of do the job. You get to work with so many different types of members of staff, which I think is a real benefit because you know how to navigate the system, especially when your rotation program is within the same hospital. What you've learned in one area, you can apply to another area, and it's not only going to be beneficial for your practice, and you know, it's not only going to be beneficial for the patients that you're caring for, but it'll also be beneficial for other nurses that might not even be on the same ward as you, that might be on a different ward. I'll give you guys a very quick example. On the rotation that I'm on right now, I was working, when I first started at this second job, I was working with a nurse who had finished her rotation, and we had to transfer a patient, and this sounds really little, but we had to transfer a patient over into HDU, and she had ordered like some machines to go to HDU, and I said to her, oh, something like, yeah, she'd ordered some machines or something that had to go over to HDU, and I was like, oh, why are you ordering all of that stuff? Like, we don't need it. And she was like, no, we don't need it, but I can guarantee you when we send this patient over on HDU, they're going to need it. And 9 times out of 10, it's not a piece of equipment that they have on the ward that they'll have to order or get from somewhere else. And I was like, oh, that's a really good point. And the reason why she knew that, the reason why she knew all of that forward thinking, was because as well as her having a rotation on the ward that we were currently on, she'd also had a rotation on HDU. So she could anticipate not just what we needed on our ward, but she could also anticipate what the patient and what the nurses on the next ward would also need. So it's really good in terms of seeing like the continuity of patient care and to see how patients move around the hospital. But again, that does really depend on the nature of your rotation program. Another well-cited pro of the nursing rotation program is that when you do finish the nursing rotation program, then there is an incentive for you to become a band 6 after 18 months or after 24 months. But again, I'm going to expand on that when talking about the cons, because a lot of rotation programs are advertised as this and this, and when you finish this and this is going to happen, but it isn't always going to be the case. I can't say that has been the case in my situation because I haven't finished my rotation program, and I don't even think I'm part of the rotation program anymore, just because honestly COVID-19 has like literally changed everything. If this was like 2 years ago, then I could say yes, I've done my rotation program, blah blah blah, but COVID-19 has changed everything, not just for the nurses on a rotation program, but for nurses in general. But yeah, like I was saying, a lot of rotation programs are saying this is going to happen, this is going to happen, this is going to happen when you finish. However, I do know a couple of nurses who have finished their rotation program, and a lot of the stuff that they were promised has never happened. So without further ado, let us go into the cons of signing on to the nursing rotation program, or cons of signing on to a nursing rotation program. I do want to say as well that a lot of the pros and a lot of the cons associated with signing on to the nursing rotation program, they're not just limited to the nursing rotation program. For example, one of the pros that I said earlier was that you're learning all the time, but let's be real, even if you just sign on to a standard ward where you're going to be there indefinitely, you're probably going to be learning all the time as well. It depends on the nature of the ward, and it also depends on your personality and what it is you want to take and give to the nursing profession. One con of the nursing rotation program is that you may not be able to get additional training in that area. Let's just say, for example, you are on a critical care rotation program, so you're going to spend 6 months in HDU, 6 months in AICU, and 6 months in PICU. If your first rotation is on HDU and you're doing the study days that are associated with just your rotation, and then you notice that some of the other nurses on the HDU ward who work there permanently, they've been signed on to other courses, you know, other short days, other study days, and you're like, oh, I want to get signed on to it. Some managers are less likely to allow you to sign on to study days specifically for HDU, just because some of them are thinking, oh, you're on a rotation program, you already have study days that are aligned around your rotation program. Why is it now you want to do a study day that's just specifically for HDU? They might be saying this HDU course is just for nurses who are on the ward permanently, and I can understand where they're coming from, because education for certain wards is limited, and managers or whoever's in charge of the study days can only, what they have to do is prioritize the staff that they know are going to be on the ward long term. If they know you're only going to be on the ward for 6 months, but you want to sign on to this HDU study day in addition to the study days that you already have as being part of the rotation program, some of them may feel a bit iffy about it, and for some people this may be a problem, for some people it isn't going to be a problem, and some managers aren't really willing to do that, and some managers are more than open to be like, okay, that's fine, because I know that you're going to spend 6 months there, 6 months elsewhere, 6 months in another ward, to make my ward as enticing as possible for when you do finish the rotation program. Yeah, whatever extra additional HDU study days you want to sign on to, I'm more than happy for you to do that. Unfortunately, not all managers are like that. Some of them are going to be like, well, you're already doing study days for your rotation, it's going to cost me money for you to sign on to additional study days for the HDU program. I'm not really going to do that. So that's one massive disadvantage of signing on to a rotation program within your hospital or within your trust. Another disadvantage of signing on to a rotation program is that it can be very stressful. Some people find it very stressful rotating every 6 months to different areas. Some people just want to be on a ward, know that that's going to be their permanent ward, whereas some people thrive off it. For some people who don't thrive off moving into different areas, it can be very stressful, because for 6 months, this is your manager, these are the colleagues that you're working with, this is how you do this is how you send bloods, this is how you report this is how you refer a patient on this ward, and then when you move over into a different area for the next 6 months, more than likely you're going to have a completely different manager, you're going to have a completely different set of colleagues, sometimes it's a completely different way of doing the exact same thing. And the reason why I wanted to really highlight stress associated with being on the nursing rotation program is because one very big area of stress that I've seen, not just for myself, but for other nurses who are on the rotation program, is the nursing timetable. This is a massive source of complaints for a lot of nurses who are on the rotation program, because when you start a new job as a newly qualified nurse, guaranteed the first at least 2 or 3 weeks you'll be working short shifts. You'll just be doing earlies, lates, and a couple of night shifts. And then once you've gone through your 2 or 3 week probationary period, I call it probationary period, but it's not really a probationary period, because more than likely you've got the job permanently. But once you've gone through the first 2-3 weeks probationary or initiation period, and your manager sees that you're comfortable working short shifts, they'll then transfer your shifts over to long days if that's what it is that you prefer, and most nurses that I know do prefer long days. So let's just say you've signed on to your rotation program and your first rotation is on HDU. The first 2-3 weeks are just going to be short shifts. After that, you'll be doing long days. And as soon as that 6 months is over, you're going to go back into your next rotation program, and you're going to go back into working short shifts. And for some people, that is a massive issue, especially when it comes to them commuting, or when they're just used to working long shifts. I know for me, I prefer long shifts are very tiring, but early shifts and short shifts can also be tiring as well. I prefer working long shifts, and if and when I do move over onto my next rotation and I know that I'm going to have to go back to working short and early shifts for the next 2 or 3 weeks, that isn't going to be the best situation. And some people can't hack it. Some people don't like early shifts, they can't hack it at all. So that's something to consider when moving every 6 months to a new area. Just because it's within the same hospital doesn't mean it's going to be the same the same set of politics. Every ward has got its own different set of politics, and nursing politics can be frustrating enough, so having to go through 3 sets in the space of a year and a half can be quite stressful. Another con of signing on to a rotational program is that where you rotate is dependent on so many different factors. You can say, you in the interview can say, yes, for sure, first ward is going to be HDU, next ward is going to be AICU, and then your third rotation is going to be PICU. And then you go and you start your HDU rotation, and then it's a couple of weeks before you rotate onto AICU, and then they're going to say, wait, we have a massive problem. When I say they're going to say, I mean like, you know, the practice educators or whoever it is that's organising rotation. Then they're going to say, hey Maria, I know, you know, during your interview we agreed that AICU was going to be your second rotation. However, we've had a massive incident and they're undergoing massive investigations. Not that this has ever happened to me, this is just random examples. We've had a massive incident, we're undergoing massive investigations on AICU. Or it could be, we've recently just employed 3 new nurses on AICU, and it's probably not going to be the best idea for you or for our patients if we were to take another new nurse onto AICU. Or it could be the case that 3 of their nurses have left, 3 of their senior nurses have all left at the same time, and there's not going to be enough people to ensure that you have the best nursing experience and to ensure that patients are as safe as possible. There are so many different reasons. Maybe the funding for AICU has been cut down, so rather than them having 20 beds, they now only have 10 beds. So now it means that you can't rotate onto AICU, even though that's what you and the person who was interviewing you, or you and the person who's in charge of rotation, had originally agreed. So yeah, that can be a massive problem for people. Again, it's not something that I've experienced, but I know a lot of nurses, particularly at my first job when I was a proper newly qualified nurse. There were a couple of, you know, nurses who had signed on to the rotation program, and their understanding was that they were going to spend 6 months in the respiratory ward, then they were going to go to HDU. However, because HDU was understaffed or for whatever reason, it meant they couldn't do that, and they just had to go onto a ward that was generally care of the elderly. And it was actually really sad to see, because a lot of them like me were like, yes, I want to do this, I want to do this, and then being so excited to do something and then being told actually you can't do that, we're just going to send you to care of the elderly, which some people love, but I know a lot of people aren't, you know, really avid fans of it. I don't want to say like it ended their nursing dreams, but it was just kind of like a pop to their nursing dreams and their nursing aspirations. Job security. Because you're rotating onto so many different areas and you do 6 months here, 6 months here, 6 months here, the promise, or not the promise, but a lot of, well, I've seen a handful of, you know, job specifications, and they say, no, at the end of the rotation you can become a band 6. No, that doesn't happen. And I'm not just talking about job security in that sense, I'm also talking about job security in terms of, okay, you've done all 3 of your nursing rotations, your first rotation was a favourite, you want to go back, but you can't go back because they're fully staffed. So what are you going to do next? Are you going to go for your second best, or are you going to go through your third best? What if all 3 of them are full and now you're just having to go to where the hospital needs you to be and not actually where you want to be? That can also be a reality. Like I said earlier, a lot of the pros and cons that I'm sharing in this video, they're not just limited to the rotational program. You can find these cons and these pros in any kind of program that you sign on to, or even if you were just to say, I'm going to go on this ward and I'm going to work here indefinitely, the same problems and the same, you know, cons and the same pros can also be, you know, something that you experience. So yeah, job security is, I don't want to say is a massive issue, but you know, I do know a couple of, you know, nurses who finished their rotational program and they were thinking, oh, I'm going to be a band 6, or oh, I'm going to be up in the run-ins for a band 6, and it never happened. Or they were thinking, oh yeah, I'm going to go back to HDU, I'm going to go back to HDU, I'm going to go back to this place, but there was no space for them, and they just ended up quitting and leaving and being like, forget it, like, we signed a deal, you haven't fulfilled your part, or, you know, somebody hasn't done their part, or something has happened, and now they're just like, deuces. Is it deuces or deuces? One other con associated with the rotation program is that you might not always like your rotations, and it's very hard to be like, or it may be very hard for you to be like, oh, I don't want to go into my next rotation, can I just go to can I just work somewhere else? It doesn't work like that, because there could be like 60 of you on the nursing rotation program, and the nursing rotation program organizers organize in a way to make sure that every ward may have like 4 or 5 rotational nurses. But if you're saying, no, I don't want to go here, I want to go here, then that's going to affect the numbers here and it's going to affect the numbers here. So it's not as easy in some hospitals to be like, oh, I don't want to do this, I'm just going to go here. That was my situation. I should have rotated onto the private ward. Prior to COVID-19 happening, I didn't want to go to the private ward, and I was telling the rotational nurse organizer that I didn't want to go there, and she was basically put in a very very sad or a very hard situation, because I didn't want to go there, but she could just move me there because that would affect this and this. And ultimately, if COVID-19 never happened, I probably would have been on the private ward, and I probably still would have enjoyed it, but it isn't something that I really wanted to do. I changed my mind during that time. There isn't a lot of in some hospitals, there isn't a lot of leeway in terms of changing your mind, because when you think about it, when you start your rotational program as a newly qualified nurse, you have no experience, you have no hands-on direct experience of how that hospital works. You can say, oh my gosh, I loved my HDU placement, but just because you loved your HDU placement as a student nurse doesn't necessarily mean you're going to love your HDU placement as a newly qualified nurse. I do want to say before I end this video as well that don't feel that just because you're on a rotational program that is the only way you can work in different areas of the hospital. Like, there are a whole bunch of people at the hospital that I'm currently working at, and they are not on the rotation program. However, there's always an opportunity for them to be like, oh, manager, I know I'm working on HDU, but can I just spend 3 months on ICU just to see what they do? And, you know, more than likely the manager's like, okay, if the other manager's fine, if they've got space for you, then yeah, go for 3 months. After 3 months, come back. If you decide that you want to stay there, then you can stay there. And that's happened to a couple of nurses that I actually know. During the whole COVID-19 situation, I know it's not over, but during the peak of the COVID-19 situation, you know, nurses were rotated to different areas just to keep up with the demand of what was happening, not because they were part or not part of the rotational program. And, you know, some of the nurses who were not part of the rotational program, they went over to AICU, they went over to HDU just to spend 3 months there just to help, you know, with the COVID, or just to help a bit more with the COVID-19 efforts. And they decided, actually, no, I really like HDU. Manager, I don't want to come back, you know, I really like AICU. Manager, I don't want to come back. And because the space is still there for them to stay there, they've just stayed there. So don't feel that just because you're on a rotation program that you're going to rotate all the time, because I'm on the rotation program and I've been on the same rotation for a year because of COVID-19. And don't think that just because you're not on the rotation program doesn't mean you can never rotate. Like I said, there's a lot of nurses who signed on to stay on one ward indefinitely, but, you know, for whatever reason, they've decided to move on to a different area and maybe come back in 6 months, come back in a year, do a secondment, or never come back. So yeah, those are the pros and cons of signing on to a nursing rotation program as a newly qualified nurse, as a new nurse, or as a younger nurse. I haven't missed out anything on my phone. I hope you guys enjoy this video. If you have any questions, comments, queries, put it in the description box below. Give this video a thumbs up, subscribe, turn on the notification bell, and I'll see you guys in my next video. Bye!